Skanda says that you can't expect how the situation is going to be. Okay, great. Shazwani says that you want to have a normal delivery to experience a short time to be fully dilated, afraid of tear and a piece of tummy. Okay. And Itzy says that 50-50, 50-50 because your first baby is an emergency Caesar. Okay, that's fair enough. So anyways, who of you agree that, like I said, birth is not a standalone journey? Everything is just, a stage where it will affect the next stage, and that your mental, your emotional, and physical health are important precursors to a good well-being. So how you feel, how you take care of yourself is important for a good outcome for baby, a good outcome for mom, and that this journey affects your relationship with your child. If, for example, you had a difficult birth, a traumatic birth, then you go on and during the postpartum, you're recovering from that. And at the same time, you have to deal with your child, right? And if your child is also traumatized by that, then obviously it's something for you to both to handle. This journey also affects parent to parent. Oh, that's nice. Expect natural but afraid of emergency C-section. Christina, thank you for that. Teresa, you're expecting a natural but afraid of emergency C-section. I guess the idea is that it depends on how much we prepare and how much angles we look at. My experience have taught me that every woman can have a natural birth. It's just a matter of whether the right elements were in it or not. I'm worried about the pain. Okay, I'll get there. Thank you for being very interactive. I really appreciate it. Okay, so I know you still don't know much about hypnobirthing, but this is a doctor that used to take in a lot of hypnobirthing parents, parents who've actually gone for the full course, and this is what she has to say. So listen to her video and then let me know what is your biggest key point from the video, right?
Educator as well an ONG practitioner. Those who do not go for proper classes, in other words, right? You can see that they have that fear. There's this wall. There's always a fear that they cannot breach. There's always negative thoughts keep flowing and flowing in. The difference, if you see mothers who actually go for classes and even the father who actually comes for classes together, they support each other, and it's easier for me to relate to them because they have got really positive vibes. They're very calm. If the mothers who do not go for classes, they're fear, they're agitated, and they have all the negative thoughts. They're very frigid. So their labor, I notice, are very long hours, and they really end up traumatized, in other words. Dad who attend, they're very supportive. I can see that there'll be totally no phones on in their hand. They'll be rubbing the mom's back. They will support them. They give them drink. They really well fed the mom, and then they will be, especially at the midst of towards the end, the crucial part when they feel that the ring of fire, they just all the J breathing goes down the drain, where they want just push the baby out. The father there, they are collected. They feel very controlled, and they will look into the eyes of the wife and say, okay, look, pull yourself together, and then breathe the baby out. I think I recommend all fathers should also, all partners must go for this. I noticed that our normal antenatal classes, their way of teaching you to overcome your fear, there's nothing there. They don't just tell you, okay, the baby is how many weeks will be as a prune and grow. They tell you the process of labor, the process of pregnancy, and then the process of labor. That's it. And then you have to dilate every hour. You have to dilate 1 centimeter and you'll be strapped on the CTG, things like that. Okay. They'll teach you breathing methods, deep breathing, but there's no pushing out the baby with every breath, let loose. They don't know. You need to push the baby out. That's the regimented way lah. Okay, that's where all the side effects of having prolapses, collagen of the perineum area who wears down. But hypnobirth, what it does is, firstly, it tackles the basic of every problem. Every mother has a fear. Even the previous mother who had previous delivery, they have got traumatized. They have to tackle that. So once they go over that one hurdle as a team, as with the husband or the partner, then they will teach you, go through how the process of labor, every moment, and then how you overcome your fear, how you to throw away all the negative vibes, and then only positive vibes flows in. And the most important thing, they will teach you how to do the proper breathing, deep breathings. Please attend a proper course. You only need to go for this one course for, I think, the 5 weeks, right? 5 weeks course every weekends with a parent. It's worth a lifetime. Only you just have to go only once, because the thing is just repetitive. You had it once, and then you will see the difference. I would advise, and I advise the parents, go as a team, as a parents, as a unit.
Okay, let me know in the chat box. What is the biggest takeaway from Dr. Zana Zalinda's message to you? Hello there. Are you guys there? Did you guys manage to see it? Yes. Support system is very important. What else? Come on. So we have not only wife, but the husband should be aware. Yes, what's happening. Support from the partner, attending classes for short, smooth, non-traumatizing labor. Anyone else who have a big key point to take from Dr. Zana Zaninda's video? Okay. Okay, so when we look at hospital birth arrangement, that's a funny one, Annie. When we look at hypnobirthing, now hypnobirthing's main focus is to focus on a positive birth. Okay. So hypnobirthing teaches you, the mom and dad, techniques and methods to be calm and utilize your body's natural design, because you actually have the ability to give birth. And I don't know if how many of you I don't know if how many of you heard her say something about the subconscious mind, the negativity, the fear, deep-seated, right? So anyways, hypnobirthing really addresses that fear, and that fear that's tucked into our subconscious mind. And hypnobirthing utilizes education, because actually, like I said, your body is designed for birth. It's just a matter of whether you can utilize it. So with the techniques, it uses hypnosis, it uses education combined together. And some people worry about, will my wife be in a trance state? Well, no. Hypnosis, part of the hypnobirthing program, comes in its form of accessing the subconscious mind, comes in the form of relaxation. So your wife will always be in full control. We're not talking about stage hypnosis. We're talking about the hypnosis that you go through almost every day. In fact, yeah, every day as you're about to sleep, you go into a state of hypnosis. Every day, if you're driving to work, because work is such a familiar route, you go through a state of hypnosis. So hypnosis is to access the subconscious mind and to really dig out the fear. Okay, and I'll go in a bit later why we want to access the subconscious mind. But yes, a little introduction on myself. Who am I? I'm Ruzana, and I have now 4 kids. My latest one is the 3.5 months, and so I took a bit of a break from January. I was still going, doing classes and tending to my clients, but I took a break in the sense of, just creating awareness. So 12 years ago, more than that, when I first became pregnant, I was like some of you, some of you said you're afraid of tearing, you're afraid of the episiotomy, you don't want to have an emergency C-section, you're afraid of the pain. I was terrified. When I found out I was pregnant, yeah, it was good. It was good news. But at one hand, the other hand was like, oh no, then what will I have to go through? Because everything I heard about birth has always been very negative. And we just take that as a normal. We just assume that's the way it's got to be. But I was like, no, it can't be. And I started searching. In fact, I started thinking maybe a C-section is easier. And then I started searching on about C-sections. And then I realized, maybe it's not so much easier. And then people say, oh, but it's either that you give birth through your vagina and you feel that pain before, or you give birth through a cesarean and you feel the pain after. And I'm like thinking, is that the only option? Is that either pain here or pain there? I need to find out. I need to make the effort for myself. And I need to know, at least I need to try. I cannot just surrender things and, just give it up. And so I kept searching and I found a story of a mom who gave birth and she had gone for the hypnobirthing course. And so the way that she laid out her story was that she had an easy birth. And of course, 12 years ago, first time mom, I'm thinking, is that possible? But I told myself, what have I got to lose? I have to try it. At least when I try it, and then I'll know what is the actual result, the end result. And at least I try it. I would have said, at least, I tried it. And if it didn't work, I'm okay with one child. Okay. And I'm happy to share with you that I have 4 children now. Of course, the fourth one was a bit of a surprise because I had all three of children very quickly. And when I gave birth to my first child, my son, the labor was 50 hours long. Yes, 50. But let me tell you, it was one of the most rewarding experience in my life. Of course, there is the intensity part of the labor, but when you know what to do for your body and when you have that support, you can have a really, truly beautiful experience, not just waiting for the outcome of the baby, but the whole journey is like, I look forward to it, you know? And for my second pregnancy and my third pregnancy, I truly look forward to that big day. In fact, for my second pregnancy and third one, the labors were much shorter. Second was about 6 hours, and the third was about 2 hours. So I felt a little cheated from it because I was pregnant for 9 months. Right? So hypnobirthing really changed my mind. It helped me let go a lot of negativity in my subconscious mind, and it helped me access true knowledge about my body's ability. And my hope is that I create that awareness with you. Yes, my hope is that you also get interested in the course and you sign up for it, and we go down this path together so that I can prep you. But if not that one, at least that you have that awareness that birth can be a beautiful experience. Okay. I am a certified hypnobirthing instructor. I am an Amani doula. I am a T-BAN counselor. T-BAN is basically breastfeeding. And I do this because I am really passionate about it. And I'm really passionate about advocating for a gentle birth because it's not just about mommy having a good experience. It's also about dad and it's also about baby. After all, the things that we do, we realize that it's all about our children's well-being. Okay. And I have over 11 years of experience working with my students and also with my clients. So students are people who come for my class and clients are people who engage me as a doula. So I've seen birth. I've seen birth in many settings and many different scenarios. And I know that you are able to give birth naturally. I know it's within your capabilities for you to give birth naturally, especially after 11 years. A lot of parents or moms would come to me and say, I had this for my previous birth. Can I have a natural birth? Or can I this? Can I that? And then as I hear the stories, I hear their points and I would notice where things could have been managed better. So yes, it's a lot about how you go through it and how prepared you are for it. So let's get to the subconscious mind. Okay, why the subconscious mind? So the subconscious mind makes up about 90% of your bodily process. Okay, so 90 plus minus. So it's a big chunk of your body. It is something that helps you with everything that's on autopilot, such as your heart rate, you know, how your heart rate beats, how you're breathing, how you're blinking, sometimes even when you're driving to work. Why? Because the route is very similar, very common. Every day, you know how it is. Like, you know, what are the turns to make. You don't have to consciously think, oh, I'm going to have to turn left and right and then go straight for 800 meters. Okay, so we work on the subconscious mind because when there is fear and stress in the subconscious mind, it disrupts your digestive system, your reproductive system, and your immune system. What do we mean by that? So when you are in a state of fear or stress or anxiety or worry, or when you are brought into that state by anything, it could be something that is real or it could be something that is perceived as dangerous. So, for example, if you have a cut, when you're in this state of mind, you take longer to heal. So, when we are able to go into the subconscious mind, we can really unravel where this fear come from, where does this stress come from. Because, like I said earlier, when you have perceived danger, your mind automatically goes into survival mode. So that's why we want to tackle the subconscious mind. Because in truth, your body is already designed for birth. I'm just wondering how many of you can actually see me on the left corner there? Can you just let me know? Yes, awesome. Okay. I don't know if you can see this, but I'm going to put it really close to my body so that it shows, because I think if I do this, then you won't be able to see it. Okay. So your body is designed for birth. Every woman body is perfectly designed for birth. And the more that I go into it, the more amazed I am with the body's ability. So, for example, now this is, of course, this is not the full course. So I'm trying to make it quick and easy for you to understand while at the same time trying to respect the time that we promise, right? So like your body is designed for birth because your pelvis actually has ligaments and joints. And with the hormones such as relaxin, your pelvis is enabled or can yield for birth. Okay? So when this happens, you know, with the contractions, eventually your baby will go through the birth canal and turn and find its way through the birth canal and come out. So your body is designed for birth with all the hormones and all the functions, even your bone structure and all that. Your baby is designed for birth. Okay, your baby is designed for birth by look at this. Babies are born with more bones. Hold on. Babies are born with more bones. A baby is born with about 300 bones versus adults. We have about 206. So what happens as the baby is born and develops into toddler, teenager, and so on is that the bone starts to fuse, and that hold on, let me see if I can show you. Yeah. So these bones here, they start to fuse, and they become one piece. But as a baby, they have this function to mold. So the bones can overlap in the womb, the bones can overlap as they go through the birth canal, overlap, make space, turn, and come out. And that's why you see some babies have a bit of a cone-shaped head, right? So again, your pelvis is flexible, you have the hormones, and your baby is designed for birth. Everything complete. But the problem herein lies in the mind. Is your mind designed for birth? The cone-shaped head, it can be because of a vacuum, but it can also be because of a longer labor, because of yeah, those kind of things. Because sometimes the baby may not be sitting nicely in birth, might not be sitting in this position in birth where this back of the head is tucked into the pelvis. So they may be coming out at an angle, and because of that angle, it will slowly shake their head or slowly shake their head. But usually, when you look at natural birth, there is still a big difference because the way that they shape the head is not like that of a vacuum or forceps. Vacuum forceps are very forceful, and there's a lot more cranial damage. Okay. For those of you who have named yourself as iPhone test admin or whatever it is, please do me a favor and adjust your name so that I'm taking attendance so that I know who's attended. Anyways, the thing is your mind designed for birth? We have a lot of myth here. How many of you think that if the baby's cord is around the neck, you need to have a cesarean? If you previously thought this or if you think this, go ahead, just type me a yes. Do me a favor and engage with me so that I understand where you're coming from. How many of you are worried that your body is petite and small that you might not yield for the baby? Or how many of you are so worried about having a big baby that you might not be able to give birth? How many of you are worried, or maybe in your first birth, you had an emergency C section or a C section because there was no progress, right? And let me know if you have any other thoughts in your head about other things that have happened that now may be a myth. Okay. Yeah. See? Yeah. Recently, when did this happen? In May, June. Recently, I had a first and the cord was wrapped around the baby's head, I think about 3 times. And on top of that, the baby was kind of holding on to one of the cords. And so and it's amazing to be able to witness this kind of birth that the mom can give birth vaginally. It's such a big thing. Doctor advice because of small baby. Well, what can you do about a small baby then, right? So yeah, it's all about again the information that you know and how you address it. Okay, so and then the negative connotations about birth is that it's hard, it's painful, it's dangerous, you might bleed to death, you have no control over it. So when all these kind of things come into us, we start to lose faith and we start to think, oh, perhaps we don't know better. Perhaps our bodies are useless, or perhaps our bodies are broken. Surrender. But when you surrender to a system that may be medicalizing your birth overly. And this is something that a lot of people don't realize. I'm just going to write it here quickly. Is that we might think that, oh, cesareans are common. We're so used to hearing that it's normal to have a 30% cesarean rate. But according to World Health Organization, the cesarean rate should not be above this range, 10 to 15%. That if it's above this 10 to 15%, that means that there is unnecessary cesarean and that is causing damage. So I want you to think on this a bit. Cesareans come with risk, come with all the side effects and risk, and not to scare you if it was truly necessary. Another thing that I want to share with you is that doctors who are pro-natural can even further bring down the cesarean rate to about 2%. Yes, there have been previously even doctors in Malaysia who have a cesarean rate of 2% or pro-vaginal at least. So these are things for you to consider. So these are just based on statistics. With the statistics, when you know more, then you can do more with it, right? Anyways, back to here, that we have a lot of these negative thoughts about birth. Um, most of these are a myth or something that you forced your body into before it was ready, or something that you didn't remedy before, you did remedy in other ways. Anyway, let's move on. So basically, in the first hypnobirthing class, hypnobirthing has 5 classes, and we go stage by stage for a very specific reason. And I like to put them out week after week so that you get to learn, absorb, practice, and start to change your mind, and then start to incorporate the lessons bit by bit. Anyways, the first class of hypnobirthing, we are going to go down into this whole myth and demystify birth. We're going to talk about how birth was long ago, before medicalization, and how did danger seep into the idea of birth. We're going to talk about how the uterus is designed, and what is the function of labor and contractions. We're going to talk about how fear affects your labor, how it causes slow progress, poor progress, how it causes pain, how it can cause fetal distress. And of course, so this is just like the gist of the first class, but we do cover other things, let's say the breathing techniques. We cover the first breathing technique. So after the first class, you go back and you already start preparing a lot of mental work, but you already start putting things into together. We also talk about the husband's role. And I find that a lot of times husbands, they come into the class and of course they're clueless. I don't know if some of you saw it, but at the waiting room, I was just playing out, I was just playing out the video of my students. And yes, husbands sometimes think it's mumbo jumbo, what is this hippie stuff? But once they enter the first class, and then they understand, oh, this is my role, then they realize, oh, actually, it's not just her giving birth. It's also me. It's also, I have a big role in it. And it's a wonderful thing to see when you come together as a pregnant parents instead of just pregnant mom. Right. So anyways, if you have any questions, go ahead, type it down. Anything else to share, go ahead and type it down. And I believe that husbands usually want to support, they just don't know how to. Okay, so that's the first class. And then here, a lot of people don't realize that how we give birth can be a big source of trauma, especially if it was negative, tiring, and we were not well supported, and we didn't know what we could do. Okay, the sources of trauma can come from an unnecessary cesarean, uninformed decisions, lack of support, episiotomy, induction, or even feeling unheard. And trauma affects mom, dad, baby. Even though dad is not going through the physical labor, I have spoken and seen dads who were affected by what they saw their wife going through. And I'm going to pull up a video here, 2 videos actually, and I would love if you could comment as you see these videos, because we sometimes neglect to think how this affects our child. And trauma affects our babies immediately and long term. So I'm gonna have to do a new share. Please let me know what you think, what you feel when you hear this. Oopsie. Okay.
Now, the baby is crying well. The baby is pink. Okay. Reflex is good. Good weight. Breathing is normal.
Oops, sorry. Oh my. Anyways, how do you feel watching that video? Go ahead, let me know in the chat box. How do you feel about the baby when you watch that video? Some of us may have conflicting views. Some of us may think, well, that's normal. Go ahead, type it out in the chat box. Let me know how you feel after watching that video. What do you think the baby is feeling? Stress. Maybe it's normal. Yeah, maybe it's normal. Stress. Or maybe it's normalized, normal baby crying. Okay. Do you think that what was done to the baby was necessary? Happy to see that the baby come out in good condition, but pity her at the same time for crying out so loud. Sometimes, babies are very sensitive. Babies are sensitive in the sense that they are small creatures. Is it normal to be crying like that? I mean, yes, babies communicate, and the way that they communicate is to cry, but is it really normal to be crying like that? Not a calm situation. So then imagine that this happened to baby, and then during postpartum, mom says, my baby is always crying, oh, my baby is always colicky, oh, my baby is a high needs baby. We label our children with all these labels. But in truth, perhaps it was something else. I'm going to pull up another video, and this video is of my students after they gave birth. Now I want you to see and then comment and do that comparison. Okay? See this baby cry. Anyways, before I do that, I just want to say that yes, trauma can affect physically and emotionally and mentally, and it can cause physical stuff is like damage to pelvic floor, mental emotions like postpartum depression, and it affects the afterbirth. Okay, so I'm gonna play this, and I guess I got to make sure that okay. Let me know now. What's the difference? How do you feel about now watching this?
Listen this video to my mom.
Yeah.
There will be a drink hang on to your hands, yeah? That's for the uterus to contract. I'm giving you medications to contract the uterus for next 6 hours, okay?
Okay.
Alright, because it's the second pregnancy, the chances of bleeding is higher, okay?
Yeah,
Alright.
So I don't have to, it doesn't have to happen all at home lah. Like last time my uterus was contracting for like few
Oh, no, you will lah, darling.
Okay, Aslan, good
Just
boy.
like that.
Mama here, Papa here, good boy.
send to my mom.
Yes, sweet boy.
And send to the group lah.
That's right, good boy.
Your mom and your sister. Oh my god, I can't believe I went through that.
Nice.
Is that okay, regret not taking epidural now?
Epidural no, Betadine yes.
But you feel like you're more in control this time?
Yes. It's just I wish I had the Petadine in time lah. I was waiting for you to get the Petadine.
Tak sempat, orang saya.
I thought it would be okay to wait until then. Because I
No
was,
lah, even if I came at 8 something, right, you're already probably 7, 8 cm. You tak sempat. I know tak sempat already. Ini I think after 8 o'clock tak sempat already.
no, I didn't realize that. I would have asked for it.
And then you will find you're happy bunny in the morning, right? Early.
Okay. Now let me know. Yeah. Skin to skin soothe the baby. Did you hear the baby cry? Mama baby, give time to skin with mama. Yes, baby much more calmer. Did you hear the baby cry? My big question to you would also be, is that baby alive? No crying. Is that baby alive? Do you need to validate the baby's life with crying? Yes, alive and no cry. Right after birth, they put the baby on the mom. Skin to skin is not only calmer for babies, but it helps regulate the babies. Baby not crying, but seems calm on her mother. Isn't that beautiful? This mom, this is her second baby. With her first baby, so she came to me on her second pregnancy. So with her first baby, she said she took the epidural, but she felt very weird and funny and paralyzed. So she wanted to avoid the epidural. So for her second birth, look, and she didn't even take any pain relief. And look how calm the baby is. No crying. Yeah, you heard a bit of noise at the beginning, but that's all. Just wide open eyes. But they always say baby must cry lungs out once born. So then it begs the question, do they really have to cry out loud? I would say I've been blessed to see a lot of babies come out being calm. I mean, yes, when they cry out loud, it's a good sign that their lungs are functioning. You know, for example, just imagine you're sleeping, you sleep with your husband, and then in the morning you wake up and you look at him and you're not sure whether he's alive or not, and then you give him a nice slap on the face, and then he shouts, you know, he wakes up. That's a good sign that he's really there, right? But I don't think you need to go to that extent. So, Nadia, that's where it is important to be informed, and that's where it is important to find the right care provider. And being informed, finding the right care provider is usually things that are definitely covered in class. Like it's a lot to take, right? So you said the healthcare providers usually take them away. In the second class itself, we talk about how important bonding with baby is to shape baby's character, you know, calmness and all that. And we talk about thinking about what is the newborn procedures that you're going to have to start opening up yourself to. And you're going to have to start thinking about your care provider style. So we talked about, you know, if my baby will be taken away from me, you have to understand this. We have different types of doctor. I mean, there's a range, even within that scope, there's the range. But the idea is for you to understand whether is my doctor the SOP type, just follow SOP. Flat out follow SOP, don't really care whether it's evidence-based or not. Or is my doctor the type that will know how to manage birth without following SOP, you know, manage birth the way the body is meant to be. So how would you know that if you do not know what the criteria are? So this is part of being informed when you make the decisions, when you choose a doctor, right? And this second class helps you start to open up and view things as, now when I talk to this doctor, what am I trying to gauge out of this conversation, and what do I want to hear from the doctor, and how do I cooperate with this doctor? How do they work with me as well to give me what I want, to get on the same level? Okay. And then the second class, you also learn the 3 breathing techniques. So you learn this, one of the breathing techniques you learn on the first class, but then on the second class, we completed again 1, 2, and 3 breathing techniques. And these are things that you will practice as we go. So as you learn the classes, you put them into practice so that they are more familiar to you. Okay, and then we also have the hypnobirthing techniques, so such as the breathing technique and the rapid relaxation and the endorphin massage. All this usually is covered in the second class. Sometimes classes may flow over to the next, or but usually on and all, at the end of the day, the classes we will cover everything. So second class is going to talk about this. And then from even the breathing techniques, you start to understand why parents or moms get so exhausted after birth. But when you know the right breathing technique and you know how to do it, and even your husband knows how to support you, then it's a dynamic flow, a teamwork, and you get the best. You saw the mom earlier. She was chitty chatty immediately after birth, right? Very chitty chatty. She didn't seem tired. She seemed alert and aware. Okay. And so boils down to the importance of the right communication. You need to effectively communicate to your doctor. If you don't, you're missing out key points. And so, for example, when I was pregnant with my second child, I went to my doctor and I was still doctor searching. And I told this doctor, and I saw her a couple of times. I told the doctor, I really want a natural birth, I really want a natural birth. And this doctor kept saying, yeah, yeah, sure. I mean, your first was, a natural one, so why wouldn't this one be? It's most likely, So every visit I would say that. And then one visit, she said, she responded with this. She said, yeah, obviously you're going to, we're not going to unnecessarily cut you up unless there's an emergency. And then it hit me. Oh no, the doctor said yes, but now she's talking about emergencies. So I asked her, what kind of emergencies, for example, doctor? And she said to me, oh yeah, if like the cord is around the baby's neck, then we're gonna have to see I mean, you're gonna have to listen to me on that. And then I knew that was not my doctor. I knew because I knew it was a myth, right? So, anyways, this is Shalini and Mohan, and when they had their first baby in 2020, she is a rather petite lady. She's a bit shorter than me, and she didn't have any morning sickness, so she enjoyed her food. So as she was reaching her EDD, like at 36 weeks and onwards, she started seeing different doctors because her doctor was trying to push her into a C-section, because her doctor was saying, oh, your baby is very big. Your baby is 4.5 kilos at about 36 weeks. And she already had attended the class, so she knew that's not true. So she started going doctor hopping. And she did give birth to a nice sized baby. He came out 4.2 kilos. 4.2, 4.3. The birth was really straightforward and easy because I was there with them, so I kind of know there was no shoulder dystocia, nothing happened, and she had it very easy. In fact, the day before I spent time with them, and on that day itself, yes, it was very straightforward birth. So here, just for you to see and let me know what you think after that. Oops.
How did hypnobirthing help you choose your doctor?
Hypnobirthing has definitely taught us how to choose our doctors that support natural birth. What are the questions that we can ask the doctors to vet them better? And we literally went doctor shopping one after another.
We changed 5 doctors.
Yeah.
Because we knew what we wanted, we went prepared when we met each doctor. And so it didn't make the process lengthy. Like, we knew at the first meet whether this doctor was the one or not.
Right.
And because we didn't negotiate, right, we had the birth plan with us. We asked them, what do you think? We could see, what their answers were directing to a more natural birth or not natural, interventions. Also, what really helped us was doctors viewed us differently.
Yeah, because we went there prepared. We had our birth plans. We started meeting out our birth plans, studying them. So they saw us differently too.
And they also spoke to us at a different wavelength. Like, they told us, this is what happened. So it really helped with the discussion, and that's how we managed to find the most suitable doctor. And
how did hypnobirthing help you choose your doctor?
Hypnobirthing has definitely.
Sorry, I'm going to have to Hold on, I'm so sorry. Someone's trying to get in, and then it had to disrupt the whole flow. So give me a second. I'll try to get to that point around here.
Interventions. Also, what really helped us was doctors viewed us differently.
Yeah, because we went there prepared, we had our birth plans, we started meeting out our birth plans, studying them, so they saw us differently too.
And they also spoke to us at a different wavelength. Like they told us, you know this, okay, this is what happened. So it really helped with the discussion, and that's how we managed to find the most suitable doctor. And when we knew what we wanted at the end, we could also weigh out all of our options and then plan what was A, B, C. Because you know, always plan A, which is your best case scenario,
Right.
and then there's plan B, which, you know, if this happened, what you could do. So you could actually plan it out and still have control over something that we never knew we could have control on.
And then we can also tell which are the things that's non-negotiable,
Exactly.
which are the things that are okay, we can still negotiate. You know?
Yeah. And then the doctors could easily also gauge if they wanted to work with us. And then you have a deal. Like it was a win-win. So doctors were okay, the doctors okay with us, and we were okay with the whole plan. And that definitely changed. Like hypnobirthing, not changed, but hypnobirthing literally made us aware of something
All
that we
those
never knew.
things.
Yeah.
Yep.
How did hypnobirthing help you?
Let's unmute again. So basically, what did you gain from that video? Let me know. I was doing some shifting in the whole yeah. Right. So hypnobirthing helps you to discuss things with your doctor. Now, a lot of people nowadays know about birth plans, but they may not be doing it in a way that is, the doctor know what they want. And a lot of people, I'm sure some of you have already heard of the idea of birth plans, but you don't know how to go about it. And that's why it's important the way that you present your birth plan is also very important, so that you know that you and your doctor are on the same page. Roughly in the third class, we're going to learn about evidence-based nutrition, what helps you have a healthy pregnancy, what kind of movements you can do to help your body not be tense. Remember about the pelvis and how it's designed for birth. But sometimes the problem is in the mind, and sometimes the problem in the mind translates into the body through tension and stress and tightens the hold it has on the body. If you have ever heard of this word fascia, so fascia affects how everything moves in the muscles, the bones, the ligaments, whatnot. And so through our emotions, sometimes we can be just relaying information into our body in a way that doesn't do its best. Okay. So we talk about birth preferences. So birth preferences are basically birth plans. And so we talk about how to go about that. We'll talk about natural inductions and what you can do to kind of get yourself there into labor. I do believe that you can't force labor, but I do know for sure that you can enhance, you can promote it. And so that's what we look at. We talk about signs of getting there, and we also have another script that we talk about, which is the glove of relaxation. So in each class, it's educational pack, and it's two ways, you know. So you can ask me your questions, and there will be exercises to do in the class and homework to do after the class, and then you also have scripts in the class, and scripts are usually designed to tackle the subconscious mind. This is what we do. We cover in the third class, class minor. Okay. So how many of you think that if your waters break, you need to rush to the hospital? Can you say yes? Let me know. Or how many of us think that if we're having contractions that are 5 minutes apart, oh, it's time to go to the hospital? What do you know about labor actually? Do you know when to go? Do you know that in some cases, depending on your doctor again, but if you go early, You might be subjected to routine inductions. There's a lot of things to start to think about here. And if you're thinking of avoiding an episiotomy, tearing, avoiding an unnecessary emergency C-section, all these kind of things, then we have to start thinking early enough to kind of have to start to map things out, prepare for things, and know what's going on, right? And then sometimes some people, they'll download the app, the contractions app, and start counting the contractions, and then the app will highlight, go to the hospital, go to the hospital. Then they go to the hospital and they find out, oh, I'm only 2 centimeters. How many of you are very confident in knowing, I know exactly when to go to the hospital, right? Well, I find that sometimes we neglect to educate parents on signs, right? I have clients and students who, for example, their water breaks today, they go in tomorrow, and then they give birth tomorrow. One of the longest ones would be probably a 4-day labor, not 4-day labor lah, but her water breaks. She goes in because her pregnancy, her baby was slightly premature side, so obviously that is the concern. So she goes in, but everything is fine, and so she goes in and out of the hospital. And on the last day, the 4th day, was when her labor picked up and gave birth. Okay, so it's not necessarily water break, go to the hospital. And this mom didn't get induced because I was with her, through the whole hospital back and hospital back. So this mom didn't get induced. She had a natural birth. I also have moms, go 2 days, 3 days. I'll wait if mucus pus comes out, but if water broke, I'm rushing to hospital. So if water breaks and you have no labor signs, then what? And the idea that if the water breaks, then the baby has no more water. Is that true? Again, the myth, the things that we hear, what's the justification behind them, right? Anyways, so then as you're in the hospital, are you being subjected to medical inductions or routine inductions? And the difference between them is that the inductions, are they just being done because they're being done? Or are they medically necessary for your condition, right? Are you being induced at just, say, 39 weeks or 40 weeks just because you are so and so weeks? Or what is the medical reason behind it? And what can you do in the hospital once you're admitted, right? All these things are important factors to make sure that you don't end up in things that you were not prepared for. In the 4th class itself, I talk about labor sensations and not just 5 minutes contractions. I go down with the moms on how and what she can expect, because everyone's labor is different. Some moms have very quick labors, maybe they're done in 6 hours or less. Some moms have a bit longer, 12 hours, 24 hours. Some moms have longer, 3 days, 4 days, 5 days. I've had moms who've had those kind of labors, 9 days. Labor is not a straight answer, right? You might think it is, but it's not a straight answer. It's not always, it starts, it ends. No, sometimes it has the up and down, that flow. But when you are able to understand, okay, now I feel this sensation and it feels like this, okay, I'm in this stage of labor, what can I do? Okay, all right, now I know this is what I should do, that's what I should do. And your partner also, they'll be a bit more in tune with your body, right? And that's how, when you know these things, you can make informed decisions better. For example, this is an example. There's many, many scenarios here, but that's why classes are quite deep and it takes that 5 weeks. So for example, we talk about informed decision. We're talking about if you are at 40 weeks and you go in and they ask you to get admitted, and then the doctor says, oh, you're already 2 cm dilated. I'm going to rupture your membranes. Okay? 40 weeks, does not mean, just because you're 2 cm does not mean that you were in labor. And rupturing your membranes so early increases your risk of infection and definitely increases the risk of more interventions, because a lot of people, you don't necessarily progress smooth just because they ruptured your membranes. But now that they've ruptured and they'll be checking you, there's room for infection. And then what if you don't progress? Then what happens? More interventions. And then the final thing will be, okay, we need to get your baby out. But had you known that 40 weeks does not mean that you need to give birth, and 2 cm does not mean that you're in labor, and you don't need to rupture your membranes, especially at 2 centimeters. I mean, maybe later on, yeah, you could opt for it. It will be better, but not at 2, right? And so had you known these things, then you would know that you could have prevented, for example, unnecessary interventions or an unnecessary C-section. So in the 4th class, as we do this, we also, we do a big thing which is called the script, the fear release script. So the script is intended to take anything out of the subconscious mind, anything that perhaps is there that you can't really access, you're not really sure of where it came from, and just kind of like start throwing it out. Because we want to support the body with a good, positive subconscious mind. Remember, subconscious is 90% of the whole body. And so even with a lot of information and education, if your subconscious is not well supported, then it's conflicting. So we want to make sure your path, your mind is really clear for it. That's what we cover in the 4th class. Okay. And then people think when they're in labor, I'm going to walk, I'm going to squat, I'm going to walk like a duck, I'm going to do this lunges, I'm going to do this, I'm going to do that to get labor moving. Did you know that not all positions can be used as and when? While I would say, yes, walking, very helpful during early labor. But there are other components to think about when you are in early labor. But if you were to be squatting in early labor, you are actually hindering the labor. And a lot of people do not know this. So how can you pair your intuition with the sensation? Right? How can you do things that actually promote the flow? In the 5th class is very physical, as in like I show a lot of like what is proposal, how to use it, and I get the dads to do it, even the massages and the counter pressure and the positions, we do it in class usually. So the 5th class is something that I would definitely recommend, even if you have been attending online. 5th class, if you can, come physically to really learn all this kind of thing, right? And all these counter pressures and all that, it is important to do them at the correct place. If you do them correctly, your dad, if you do them correctly, they bring great relief. But if you do them wrong, then she'll push your hand away. She won't like it. So in class, we learn how to do them correctly, right? And I teach my students that if she doesn't like it, maybe you need to double check with her. Maybe you need to correct yourself. Yeah, because a dad presence is very important. And fathers, they usually love doing the counter pressures because they are very strong. This is one of the things where if they do it correctly, they're like, no, let me do it, carry her, or let me do this. They do the heavy lifting. And to encourage for labor assisting position, one of my recent clients, because she was 41 weeks plus, and she was normal. This is her first attempt for being back, and so she was at home in a hospital at home, and at the point when things were getting intense, then when she went to the hospital and she was asked to be pushing, right? And then after some time, the husband noticed that she is tired, and he told the team, he said, you know what? Can you just let her rest? And so she rested. And reflecting on it, she was telling me that at that point of time, she didn't think of resting. because she's in the moment. She can't be thinking about those kind of things. But I'm so glad that he asked me to rest. That's what she said. And sometimes it's that if the dad knows roughly how to look after her, advocate for her, those little things. Okay. So I hope so far you understand very clearly what the first, second, third, fourth, fifth class cover. Okay. And usually every time I do this kind of previews, I always offer this 200 ringgit rebate, which is what I'm going to offer you guys now. You don't have to register now. What I say is that you have until the end of today to kind of give time to think about it as well. But at the end of today, so tomorrow is the normal rate. I know some of you already know my rates are 1,480. It is an investment. You learn all these kind of things so that you can apply it in your life for your child. And I know a lot of parents who have benefited from this and also go on to have that empowering thought. Okay, it is 5 classes. So this fee is for my group classes. If you are interested, you can drop my admin a text and just tell her, okay, I'm interested. How do we register today and how do we find out the date? I do have physical classes, and physical classes I hold up in my center in AU Tiga Kramat, that's near Satya Wangsa. I do have online classes as well. Usually physical classes are on the weekend and online classes on a weeknight. And there are some who let's just say they can't make it for one class, one online class, then you can look at the physical class dates and come for that replacement in that sequence, right? Or some of them will say, but I would like to have the hands-on experience for the massage techniques and all that. Then you can do a hybrid also. So you don't have to come for all of them physically, and you can do some of them online. So in this way, manage your time better. This is the extra that I allow for it lah. Okay. And you do get homework. You and your husband will have homework to do as you go home for the week. And they're not hard homeworks. They're like reminding you to breathe, to practice certain things. And some of the homework you'll probably be doing as you sleep. Okay? And you will, like during the course, you will get the book, the textbook, and the handout, which I don't have the handout here, it's in my center. You get MP2 track, you get to witness the videos, hypnobirthing videos, so that you can actually see it for yourself. Just now you saw a video of my student with the baby on the chest. But in class, you will see birth videos, and you can actually witness and see it for yourself that it is possible, right? And for those who think, oh, but I'm too early. Honestly, the earlier you are, the better. I have moms who come late, but my suggestion is always the earlier you are, the better. Okay? Pregnancy is a time that you have 9 months for it, right? Instead of waiting last minute, it's better that you do your work now so you can start preparing things in your favor. But of course, if you are last minute one, still can. And if you are worried that you might forget, my suggestion is start early, and then you can always, within the same pregnancy, you can always say, hey, Ru, do you have a next available group class that I can drop in on? And you can just say drop in on the second class or the third class of that session, as long as you've done, the whole course already, to refresh. Okay. Usually, I take currently I take a 20% deposit for those who are registering. When they contact me without this preview, they contact me, they will register. I take a 20% deposit. But for today, if you are interested to book in the 200 ringgit rebate, then I'm only asking for 100 ringgit deposit. And on top of that, a money back guarantee. Let's just say you're really interested in the class, but at the same time, you're like, you attended the first class and you thought it was a waste of your time. Then you can let me know, and before the second class, you don't have to attend the second class, and then I will refund you your 100 ringgit. So first class, and if you cancel, immediately after that, then I will refund you 100 ringgit. Why I do this is because I'm very confident that the program will teach you a lot. The program is very insightful and very helpful for all types of births. And that's the Yeah. So each class is around 2.5 hours. Like so far, I've been talking to you right now, and if you think that whatever I've been sharing with you is very informative, well, honestly, I'm very confident that once you get into the program is way more in depth, in detail, and your concerns, like say, the quadrant, I can explain all those kind of things to you. What is behind the story behind it, right? So that you can be more confident to address things in an informed manner. Right? And I really hope that you want to do this. Right? I want to share a few case studies so that you can relate to them. Okay, so this is Nadia and Luke. They gave birth last year, and Nadia came to me through this preview, and she was very skeptical. Honestly, she came to me, and when she started classes, she was saying, "Oh, I want the epidural." That's her plan. She wants the epidural because everybody tells you just take the epidural, right? And what I loved about it was how she can shift her mind, and it really changed from wanting the epidural to saying, okay, let's try without it, to going 10 centimeter without epidural. So it's quite amazing how when you shift your mind, your body is able to do amazing things.
Hi, my name is Nabila.
Hi, my name is Luke.
We are first time parents. So the reason that we went for hypnobirthing, the reason that I searched up hypnobirthing is because I had a lot of anxiety around birth, especially since this is the first time I've gotten pregnant and this is the first time giving birth. I didn't know what to expect. So to kind of mitigate that anxiety, I did a lot of research, and one of the things that came up that everyone said was really beneficial for them was hypnobirthing. So yeah, that is why I went.
I didn't know anything about hypnobirthing. I just heard about it from her. The thing is, she's a very anxious person, so she does a lot of research for herself, and then she feels me in it. I was very intrigued. Really, I thought it was some voodoo sort of thing, but learning that it is more on the about calm birth, that was much more interesting and helpful.
So this is from Luke and Nadia.
Hi, my name is Nabila.
Okay. So when you attend the hypnobirthing course, there are benefits not only to baby, not only to mom, also dads. And for moms, they're very obvious, reduce the need for drugs, avoid unnecessary interventions, avoid complication. She knows how to work with her body to go through labor. So instead of halting the labor, she knows how to make it smooth flowing. Postpartum, usually when moms practice hypnobirthing, they feel fresh, they feel alert and energized. And so the pregnancy time is utilized for positive birth instead of being all like, oh my God, I'm worried about this, I'm worried about that. I hope that you find the answers to debunk your worries. And that's my hope for you. And for moms, lower risk of hyperventilating and interrupting labor, smoother bonding and breastfeeding. Okay. For me, moms' benefits are very obvious in the sense that, yeah, who doesn't want to avoid complications, right? For dad, so I've had over the years I remember this one couple, a few couples actually, but let's just say even though the mom had a normal birth or a natural birth with the first child, I remember with hypnobirthing, because of the involvement of dad for the second child, she told me he's much bonded with her. He's much more gentle with her, and it's an amazing thing. And I remember this one that mom had two C-sections, so the third one she wanted a natural birth. And because he's the one who received the baby, he's very bonded with her, and he's always very protective over her. It's like that special bond. And it's just amazing to see this, and it's amazing to see the empowerment back into their hands. Okay, so as a husband, you learn to advocate for your wife better. You learn to negotiate and communicate with the doctor better, and you learn to be a real support. A lot of dads, I know this for sure, I'm pretty sure a lot of them will want to support their wife. They don't just want to abandon, they will be there. You can hold their hands and whatnot. But sometimes holding hand is not useful. And for husbands, your role is significant. You have a lot to do. And like you need to be the voice for your wife as she is in labor, she's in the primal state. So you know how to participate actively in during labor instead of just being a bystander. And you can be more proactive instead of panic. And you can communicate, sorry for the spelling errors, anyways, communicate to the doctor effectively. And you can really know how to go about with labor. You can see, oh, she's in this stage. Oh, let's do this now. Oh, honey, do you want this? Proactive role instead of just, okay, hold my hand and squeeze it. This um this is my student client as well, and for her first birth, she had a cesarean. At 37 weeks, she went for her checkup, and the doctor told her, "You're having a big baby. You have to have a cesarean." She tried to wriggle her way out. She asked the doctor, "No, but doctor, can I want to try at least a vaginal birth." And it's like, "No, your baby is too big. You have to have a cesarean." So she passed a little like corner, right? And when they did the operation, she said that the doctor took out the baby, weighed the baby, and he said, "Oh, I'm sorry, your baby's only 3.2." And he repeated that story a couple of times and to the husband later. And she felt cheated by it. She truly felt cheated by it. So for her second baby, she came and she had an even bigger baby and a natural birth. And even for her third baby, a natural birth. So this video is them in preparing for their third baby. They just came to me for a refresher. But yeah, it's in Malay. So for those who don't understand, I'm sorry. But yeah.
Sebenarnya dah tahu dah berkenaan hypnobirthing ni, since daripada yang first baby kita just pergi
One time talk
tu.
Jadi that time tu kita macam very amazed with the birthing lah, after they show the video of baby sedang nak bersalin, and then the baby deliver tu, baby tu will become, so then kita tak take it
serius lah.
boleh
belajar sendiri lah.
First tu kita macam tengok 1000 tu macam 1000 tak apalah, kita tengok the internet lah, kita read books lah, kita beli buku. Actually I did buy this one pun, ada beli sendiri pun, tapi yelah macam orang kata
belajar ni kena ada guru.
Can see lah the different masa kita ada first one tu, macam doktor tanya, oh kenapa you nak bersalin position lain ke apa, what's the reason scientific behind it, kita macam alamak nak jawab macam mana tak tahu kan.
Sebab dalam buku tulis okay, position macam ni kan. Tapi dia tak explain pun kenapa ni, kenapa kan.
Ada macam kena ambil epidural, you nak sakit ke, you nak ini ke, you
kita tahu je okay, epidural tu tak nak bagi sakit kan.
Itu tak tahu pun actually behind the epidural tu kita sendiri ada the hormone yang as good as an epidural kan, the natural hormone tu. And then I would say 1000 tu time tu, yelah 1000 kita nak elakkan 1000 tapi kita kena 16,000 sebab Caesar. And also the orang cakap dia explain the bad memories, sebab kita rasa feel cheated dengan doktor tu kan.
Itulah yang itu paling kita paling rasa sedih, kecewa.
Pantang dia, so macam asyik fikir the doctor ni paksa Caesar pada 37 weeks, and the baby pun kesian sebab dia tak cukup matang lagi semua kan. And then compared to the second one ni, we follow the class, beza lah. And then kita macam during after deliver tu macam dah
relax lah,
berjaya macam aku beranakkan anak ni natural without painkiller semua.
Bila baby nombor 2 ni, wife saya memang berkeras. Dia kata dia nak pergi kelas. Dia kata dia tak nak just pergi baca je, dia nak take seriously lah. Dia percaya yang sepatutnya setiap ibu ni boleh bersalin secara natural lah. Kita join the class lah. First class pun dah start tu buka kita punya minda lah sebenarnya. Benda ni bukan something yang you boleh baca tanpa someone guide properly lah. So on paper tu is betul, tapi tersurat dan tersirat kan. Apa yang tersurat tu sebenarnya apa di sebalik yang ditulis tu, apa semua tu kita kena belajar lah benda tu daripada orang yang tahu pasal benda tu, pasal hypnobirthing.
That time baru macam ada kampang, okay nak kena ambil juga kan kampang.
Saya lah, kalau saya personally advise
Pergilah. Pergi belajar.
Kita bukannya belajar pasal diri, kita learn about position.
Everything tu yang birth plan apa semua tu memang kita belajar kat kelas lah. Kan, kalau based on buku semata, memang benda tu akan ada tulis kat dalam tu. Tapi kita mungkin akan ambil mudah lah benda tu. Sebenarnya maksudnya okay, birth plan ni kita kena ada ni. Tapi tak macam betul-betul kita serius, kita sampai present, kita discuss dengan doktor apa semua tu. Sebab since dekat kelas kita kena present kita punya birth plan dan kita pergi jumpa dan ada follow up lah, kan. Maksudnya macam mana doktor respon apa, kan. So at least ada someone yang guide ataupun push kita untuk tahu apa feedback doktor, kan, berkenaan dengan birth plan yang kita buat tu, kan. Bukan simply macam kita buat dan doktor macam nantilah tak apa ke ni, kan. Lepas tu kita pun macam okay lah, tak apalah, benda ni kita je pun nak tengok, kan. Macam tu lah.
We know the objective of the birth plan tu lah, kenapa kita nak
kenapa benda tu perlu ada black and white lah. Kalau kita boleh go back time, kan, kita join the class lagi awal lah sebenarnya. Kan?
Right. So yeah, my hope is that you can avoid painful scar, C-section tearing, painful contractions. You can avoid being clueless and just blindly accepting interventions, because again, not all doctors practice the same manner. You can avoid fetal distress and iatrogenic issues. Because in class I will be teaching you, like for example, how to avoid tearing. And it's not just through breathing or perineal massage. There's more to it. How can you really avoid tearing? Because over the years, I've learned to improve things, and I realized that yes, there are a lot of scenarios actually we can do something about it. And to have this information, you learn it once and you can apply it many, many, many times. So for example, for me, I learned hypnobirthing, and I just applied it for my recent child, my fourth child. And for me, it's an investment. It really changed, and it really gave me an empowerment to know that I'm capable. Because initially, I think a lot of us wonder if we are capable of it. But more than that, you are capable. And your husband's big role, is it advisable 47? I have done, okay, so that's a great question. You see this mom here? She did it at 37 weeks, and this was like at 2020 or 2021, and she did the class at 37 weeks. Of course, my advice would be come early, and that's why when you look at the Instagram ads or the Facebook ads that I did, it says that 33 weeks and below, but I guess some of you missed it. I definitely encourage, and I say come early so that you have time to prepare. But for example, this mom, her first baby was a cesarean at 8 centimeters. Just imagine that. In fact, her husband tried to negotiate with the doctor. He's like, why can't she have, but at that point he didn't know anything. And so for her second baby, she came to me roughly around 37 weeks, messaging me, and then she called me up, and then she was crying, and she said like, I really want this birth, this vagina birth. Everyone comes to me and say, I want a vagina birth, and I will always ask, do you want a vagina birth or do you want a natural birth? There's a huge, mega huge difference between these two things. Anyway, and then she's crying on the phone because she says that the doctor doesn't recommend it, and the doctor talks about uterine rupture, and what if this happens? Are you sure you want it? So he kind of scares her, right? And then even the husband, at that point of time, the husband was like, why do you want this? Are you sure you want to risk? Right? Because husbands are logical, men are logical. They would think, oh, it's a risk, right? And then when she was crying, she was talking to me, and then women are sometimes emotional. They think about all this emotional stuff, how you feel about it. But little do you know that these two things complement each other when you have the right information. So when she spoke to me and I spoke to her, I gave a bit of information, and she said, okay, fine, I'm going to drag my husband for this. And so they came for the first class, and it changed him. Okay, he turned, he changed, and he realized, oh wow, so I need to support her, right? And I need to do it in this manner. And she gave birth at 39 weeks. They were also my clients. So I remember on that day when the husband texted me, Roo, I think it's time to come now. And I came and then I saw her during that stage of labor. And then, it was time. So we went to the hospital. It was like 15 minutes away and the water released in the hospital. Now, not every situation the water might release early. In some situations, the water might release later. So labor is unique to everybody. Anyways, she was wheeled in. Like immediately, the medical staff took the wheelchair, wheeled her in. She jumped onto the bed and she gave birth. So imagine being stuck at 8 centimeters with fetal distress versus being equipped and then having a natural birth. No epidural, no induction, no nothing. And the best part about that is that the recovery and the bond is it's really powerful because you have the hormones to help you with. And even her third baby was unexpectedly at 34 weeks, so considered premature. But because she already had the hypnobirthing knowledge with her for the second child, he was born very healthy, didn't need the NICU, and she did it naturally. And he was, in comparison, the second baby was 2.4 kilos, the third baby was 2.3 kilos, something like that. So yeah, hear it from them.
How was it different? I mean, I know Suresh is super supportive, but is there a difference with him, with Nilan versus Rana? I mean, like his knowledge with birth, did that help him become a better person for you? How was it different for you?
I have to say it out. During Neelan's time, I was in the room, the labor room. I took my epidural. Okay, that point of time, because everyone scare me that before 7 centimeter you must go on epidural. If no, doctor won't, and all these things. So
being born in an Indian family, right? Going through all the drama that we watch in the TV, giving birth is all about screaming and all. So that's why we opt for the epidural because we didn't want to have that pain and all. You see?
Yeah. So after before after I got myself admitted because that time I was just 3 centimeter opened and doctor said get yourself admitted and let's induce labor, let's wait. So the whole process at 7 o'clock I got admitted during Neelan's time, and all he did was sitting there. Yes, he was supportive, but he was playing game.
Nothing to do with that.
He was playing game.
I thought my role was minimized.
Yeah, I won't blame him, but he was there. He was holding my hand and everything, but in the other hand he was like,
this is pre-hypnobirthing, but post-hypnobirthing, I think the word here would be the silverback gorilla, is it? Yeah, so I did that part because I think the knowledge here for the dad to step up for whatever situation, for whatever circumstances, to voice out, to tell the doctor, you see, hey, this is what I want, to be firm there. Because the wife is in pain, the wife is going through this pregnancy, she can't be telling the doctor all of this, right? So the men have to step up there to be the silverback as gorilla, to actually tell nobody comes beside my wife, okay, this is how I want it to be happening. This is what I want the delivery to happen. Yeah. So let it be doctor or anybody who comes beside, I will be there protecting my wife to say, no, this is what I want. Okay, this is how I want it. Yeah.
So that is the difference between
there is a difference from playing game and being the man. Right? Yeah. So once again, thanks a lot to the knowledge that is given by Ruzana and the team. Yeah.
Basically, they, of course, when they came to class, they decided to change their doctor, and they had a very supportive doctor who was on board with what they wanted. And so he didn't have to be gorilla, but there's this word that I use for the dads in class. I call them the gorillas because they are supposed to emit that energy, that protective energy for the mom, right? And so, yeah, imagine, it was so rewarding, like he was very happy that she got this kind of birth. He came out of it, he was very happy, because I had to help them move their car because their car was parked in the emergency area. So when I moved the car, and then after that he came, he was like, yeah. So it's a beautiful thing to see when women are supported and equipped with the right knowledge to give birth in a easy, smooth way. And my hope is that this applies for all of you, right? Okay. We are pretty much coming to the end of things. I usually show this, but I'm going to show this later if we have time. But the idea is that sex and birth are very similar. If we don't have time, then I'll probably just share this link with you, and for you to see it, please show this to your husbands if your husbands are not here with you, because I find this video really eye-opening in the sense of how we treat birth. We don't realize that we are disrupting a lot of things. Right? Anyways. The benefits for babies are that they are better adjusted. They are contented babies. I don't know if I'm sure some of you already have seen like these osteopath videos going around on social media where the guy corrects the babies, cranial adjustments and all that. But when you have a calm baby and we have a calm mom and you give birth in a calm manner, you actually promote health for the baby, and you actually reduce the risk of tension and issues and sucking issues and breastfeeding issues. Sorry, not sucking issues, breastfeeding issues, issues with bowel movements and all those kind of things. So it is overall, you're looking at general well-being of the mom and child. And because the mom has been calm, the child is also calm and easier to handle. They're not very agitated easily. And so you also very much learn about fetal distress, and you learn how to avoid all the cerebral palsy. You learn how to avoid a mouth trauma, emotional trauma, physical trauma, right? And why not? Because prevention is better than cure, right? Okay. On top of that, I also go into details of other things such as talking about fetal distress, because a lot of us do not realize that when we use that CTG on the mom's belly, the CTG to monitor for the heart rate and the contractions, yeah, we don't realize that detecting for fetal distress through the machine is inaccurate, that are high false positive results. That means to say there's a lot of times your baby is not having fetal distress, but because of the high false positive, then you think, oh, baby's having fetal distress, and oh, okay, fetal distress, C-section. Okay? So I want you to be more informed on knowing how to navigate your way through this. And it's important so that you can avoid an unnecessary C-section. And for mothers who've had a previous C-section, I'll go down with you in the details of a C-section massage. And as we see each other weekly, usually, and even after class, you can always text me. That's where the WhatsApp support is. So I say throughout pregnancy, but once your labor commences, it's different because I'm also a doula for my clients. So you can definitely WhatsApp me throughout your pregnancy, and then yeah. So I also talk about, like I said earlier, I'm gonna teach you how to avoid tearing, and it's not by chance; it's actually avoidable. All these things are already there, and you have the means to avoid tearing, avoid tiredness, avoid exhaustion, and all such things. I've also, after the first class, usually I will also give my students an e-drive link where they can access curated books. I'm not talking about books such as what to expect when expecting, because those kind of books are very general information. Books like Mayo Clinic general information. I pick books that are geared to help you have a positive view towards birth, like books by David Chamberlain and Ina May Gaskin, books by Ibu Robin Lim. Yeah, all those kind of books that really matter. So not just any book, but specific books that are in the drive. And these are just like additional things that you can have access to in order to gain deeper understanding, different perspective, and really strengthen your mind, because again, your subconscious mind is where the bulk of it is, and we want to support that as much as possible. And for those of you who have specific concerns, you're most welcome to just seek out my thoughts on things. Like I've had moms who've had these issues and how we deal with them. So that, for example, there's one mom with GDM and she was detected way early in pregnancy and she came to class way early in pregnancy. So I would tell her, okay, let's now take a look at what's happening in your food intake and, let's monitor. And towards halfway through, she was very confident with what she was doing and how it was impacting her sugar levels, that she already knew how to keep it in check, and really remove herself from this risk. So understand that you can do something about it. It's a matter of whether you want to or you don't want to. Yeah, so for those who want to, you can snap the QR or you just drop my admin a message. I want to also open the floor for Q&A if you have any questions. Yeah, if you have any questions, you can also unmute yourself. I did notice some questions. Hold on. Is it advisable? So Teresa, I would think that if you knew late, then it's still an opportunity. How many of you found that pretty informative? Let me know. What are your questions? Like we have here, like Adiba, Ash, Diana, Grace, Isdi, Jessie, you've been quiet. Lian, Mama Oma, I'm not so sure who you are. Yeah. So go ahead, let me know what questions you have when it's okay. When is the next class? Nadia, I do have October classes, our physical classes. I do have September classes starting, I think, around mid-September. That is an online one. I will probably ask my admin to drop you a message, Nadia. Okay, but just if any of you have any sort of question, hold on, the pen is not working. Okay. Any of you have any sorts of questions and you're wondering if this applicable for your situation, or any myth that you're now coming to think of, maybe it's just a myth, or anything that you're curious to know about, go ahead, drop me a question. Class schedule will not be posted here. Usually I would have them reach out to me, so reach out to my admin, and then she will share this class schedule with you guys. So my main goal here today is a lot on awareness, and obviously, like I said, I do hope that I will see you for class, but if you're not interested, then it's all right as well. It's the main thing is that I create the awareness and that you know that it's possible. And we're not talking about just giving birth to the vagina. We're talking about a real different experience, where you look forward to giving birth versus you're scared about it. You have information on how to deal with labor versus not really wanting to or not participating it positively. Okay, so go ahead, Teresa, Ifarina, if you have any questions, Atika, I don't know who else is here, Shazwani. Ask specific on doctors about bone natural. Good question, Karen. Okay, so Nadia, once we get into classes, I can definitely tell you what doctors that you can consider. So I would say that all doctors are different and they may be pro-natural in something but not pro-natural in other things. So definitely these things we'll cover it in class. And when you go to a specific doctor and when you have talked to them as well, And the feedback itself, I can tell you from the feedback, how does it look like it's going. So is it when leaking water more than 24 hours, mom should deliver the baby by C-section. There is this thing that we think that labor is defined by time. Labor is not defined by time. So it is not about, oh, it's this long, then, oh, this will happen to mom, and so on. And so it is by conditions. By right is by condition. So I've had moms who go more than 24 hours leaking. So you're talking about the water bag releasing, right? The air ketuban release, and they go more than 24 hours. And if you know how to keep the condition in a good state, you can get more than 24 hours. You can get even 3 days, 4 days. Right? So it's not necessarily they need to have a Caesar. Right? But that's a good question, and that's a good thought, right? Because we think, oh, a lot of moms will think, oh, but I needed the cesarean. Yeah. And then some moms will come to me after 2 cesareans, and it's sad because, okay, so this is subjective. Some government is okay, some government hospital is not okay, but at the end of the day, you need to know, at the end of the day, you need to know what is your right and how to play them out. So basically, you need to know that, okay, they may not be so well aware about things, but you need to know your rights. Okay, and a lot of people think that government hospital promotes natural birth. I'm really unfortunate to say that it's not happening nowadays. A lot of moms are getting cesareans from government hospital due to the lack of bed setting and time setting. So it's really important that you also know how labor is, so that at least you do not go in too early, waste your time, those little things, Yeah. So they may not be as accommodative because government hospital depends on which doctor you get as well. Some are better and some are not. Nadia, why is the doctor suggesting you need a Caesar? Is it because of the same reason as last time? Okay. How many weeks were you with your first child when she was born? It's a girl, right? Girl? Okay, 37 weeks. Okay, 37 weeks. That's still quite early. Even if you go by WHO standards, they would say wait at least 39 weeks if possible, because at 37 weeks, it's like borderline, and still considered 2.3. The mom just now had her baby 34 weeks at 2.3. So 2.3 is not entirely small, right? And like you said, baby was 37 weeks. So perhaps if you would have been allowed to labor naturally, you might have given birth at 40 weeks, and baby may have been maybe a nicer weight, 2.7 or closer to 3, those kind of things. So yeah. Again, ultrasounds are usually just an estimate. So like one of the moms I shared about just now who had cesarean and spent 16K on the cesarean, ultrasounds are an estimate and they can vary widely. So he estimated that the baby was bigger than 4.5 but came out 3.2. Yes, earlier birth does affect baby's latching as well as baby's breathing, because when babies don't come out when they're ready, this is either by C-section or induction, they actually, what happens in the last few weeks when the baby is preparing to be ready is that they are getting their lungs more adjusted. So babies who come out earlier are more prone to asthma, breathing issues, and even sucking issues and all those latching issues and all that. Yeah. I'm loving the questions. How about the first time moms? Is there anything that you have concern for? I really hope that this has been insightful. Anyways, so let me know if you have any other questions. It's fine. You just put them in the chat box. What I'm going to do now is I'm going to open that video that I mentioned. And while we watch that video, if you have any questions, I will definitely answer it. Hold on. So this video is not in English, but the same rules apply to our birth, you know, how we treat our birth and how we sometimes we over medicalize it. And yes, watch it, get your husband to watch it, share it with your husband if possible, and let me know for any further questions. But other than that, then just here.
Data ultima mestruazione?
Il 22, sono al 14° giorno.
Bene, vediamo le analisi. Emoglobina, le piastrine sono a posto, ecografia, i tamponi vanno bene. Ecco lo spermiogramma. Pochi spermatozoi con motilità ridotta. Vabbè, vediamo se ce la facciamo. Beh, magari se la signora è molto fertile. Visto che ovula oggi, dobbiamo fare tutto entro stasera, eh? Pressione?
120-80, sono ancora ai preliminari.
Ma perché sono ancora vestiti così?
Cambiatevi, per favore, mettetevi i pigiama.
Ecco, bravi. Allora, Silvana metta il monitoraggio, così lo teniamo sotto controllo. Temperatura?
36,3 lui e 36,9 lei. È proprio in ovulazione.
Ottimo, bene così.
Allora, adesso non preoccupatevi. Il concepimento naturale è una cosa bellissima. L'hanno sempre fatto tutti. Respirate bene, altrimenti diventa tutto più difficile. Fate finta che io non ci sia adesso. Brava!
Ma no, ma chi li ha messi così? Così non va bene, eh? Su, scenda. Allora, lei signora si accomodi sul lettino. Brava. Ecco, adesso apra le gambe. Brava, così. Non abbia paura. E lei sopra. Venga qui. Perfetto. Potete procedere. Ecco così. Bravo, bravo. Adesso al mio 3, eh? 1, 2, 3. Spinga! No, no, non ha spinto bene. Riproviamo. Al mio 3. 1, 2, 3. Spinga! No, non esca subito! Così non ce la facciamo, eh? Su, non si scoraggi. Qual è il problema? Ho capito. Silvana?
Sì, dottore?
Dia un aiutino al signore e facciamo un altro tentativo. Come? No, non può bere, eh? Si bagni le labbra. Adesso le facciamo una bella flebo, diamo un aiutino e la trattiamo un po'. La tira un po' su.
Io non ce la faccio. Scusami. Non ce la faccio. Andiamocene via, per favore. Non ce la faccio proprio, cioè non è proprio possibile così.
Dai, amore, fai uno sforzo, ti prego. Lo so che non è facile per te, ma qui sono bravissimi.
Sì, non è sforzo, vabbè.
va? In questo ospedale facciamo tutto secondo la fisiologia. Le cose devono essere naturali, il più naturali possibile. Però, se serve, ci siamo noi. Facciamo un altro tentativo, poi, se non ci riesce, la signora la fecondiamo noi. Bene? Allora, come stiamo andando oggi?
Bene. Oggi già 3 naturali col Viagra e poi 6 fallimenti e abbiamo fatto noi l'inseminazione. Per domani ce ne sono 3 prenotati con il naturale e una coppia che vuole andare direttamente in sala operatoria. Non vogliono neanche provare, io non li capisco.
Lo so, sono le coppie in realtà che non vogliono il concepimento naturale.
Su, siete stati bravissimi. Avete fatto veramente il possibile.
Adesso ci pensiamo noi, eh? Siamo specializzati per queste cose.
Che mettiamo come indicazione, dottore?
Metta mancato impegno della parte presentata.
È stato grazie al dottore. Io non ho idea di cosa mi sia preso. Tra l'altro non mi era mai successo prima. Comunque, senza di loro non ce l'avremmo mai fatta.
Sono stati bravissimi.
Auguri.
Grazie.
Grazie.
All right, thank you very much. I hope you kind of enjoyed that video and you kind of got an idea of more how, you know, how we treat birth. It should be similar to how we treat sexual intercourse because of the settings the hormones that's required. Now, I don't want to take up too much of your time, and if any of you are really interested in engaging me to learn for the hypnobirthing, you just drop my admin a message, and you have till the end of today to take advantage of that rebate. But if there are no further questions, I bid you a good day. Enjoy your Saturday, and I hope that you felt you had a very informative session and that it brings a lot of awareness to you right now. Thank you, Nadia. Thank you as well, Christina. Thank you all for attending.